Hi, I'm Kat Toronto, and this is Matt Toronto, and we are here with you from AesthetiCare Medspa. Welcome to our virtual open house.
Yeah, we love these virtual events because even though we would really love for you to be here live, we know some people work and can't make it. And we look forward over the next hour to thoroughly educating you about the aesthetic industry and specifically about aesthetic care. Now, you're going to get a lot of information over the next hour, but you may have questions. So you'll see there's a question tab. You can click on that. And towards the end of this 1 hour virtual presentation, submit any questions and we're going to answer them live for you. Now, there's a huge benefit to staying to the end because everybody who stays to the end is going to get a chance to get entered to win a $1,000 gift card to AesthetiCare. So make sure you stay to the end, and I promise it's not going to be boring. You're going to really enjoy it, and our goal is to thoroughly educate you.
And all of you watching can participate in our biggest sale of the year. So you can put money on your account, and you get 20% off of any service that is paid for with that money. So 20% off of all of our services can be taken advantage of either over the phone, on our website, or come on in. We're having this great party. It starts at 3 o'clock. We're going to have live music, eats and drinks. We have a lot of local businesses coming out, so you can mix and mingle with them as well. We look forward to seeing you, and thanks so much for staying with us through this online event.
Hi, and welcome to AesthetiCare Medspa. I am Matt. This is Kat Toronto. We're the founders. We opened AesthetiCare in 2001, and we love being a part of the Kansas City community. We now have 3 locations. We have Liberty, we have Ward Parkway, and we have Lenexa. And we have been honored as one of the top 10 med spas in the United States by the American Medical Spa Association, and we're now one of the largest med spas in the United States. You know, a lot of people in the Midwest feel like, boy, I bet you if I went to New York or LA, they might have better stuff, and that is not true. We are always going to have the best technology. We're going to have the best trained staff. And more importantly, we just love what we do. Tell them about some of the things that make AesthetiCare wonderful.
Yeah, I think the number one thing that makes us so special is our team. We have over 65 team members with over 350 years experience in aesthetics. I mean, that's amazing.
Incredibly well-trained.
Yes, and we have a board of directors, including a plastic surgeon, a dermatologist, and an anti-aging specialist. We're also partnered with a national training facility, Mint Aesthetics, where we've worked with over 2,000 clinics worldwide because we have an online program as well. So we really want to make sure that our team is trained to the highest level so that we can offer you all the most amazing care.
You know, the average med spa in the United States has 5 to 6 FDA-approved devices for treatments. We literally have over 70. And we're always going to have the most advanced, the best devices to make sure that our outcomes are the best. And we have a saying here when people think about aesthetics, sometimes they get a little nervous about, am I going to look different? Am I going to not look like myself? We are focused on a natural look. With our injectables, we have a saying, the best injectable is the least detectable. And with our lasers and everything, our goal is to make you look younger, more youthful, but still look like you.
We are excited for you to come check out AesthetiCare and learn more about all the things that we can do for you. You can check out our virtual consultation online, or don't hesitate to give us a call for a complimentary consultation. We look forward to taking great care of you.
Let's talk about needles. Needles, to a lot of people, are scary, but in aesthetics, they are wonderful. And I'm talking about aesthetic injectables, neurotoxins, and dermal fillers. Now, the neurotoxin you have probably heard of is Botox, and it is the largest, most popular in the world. It's been around the longest. But there are several new neurotoxins on the market, including Dysport and Daxxify, that are absolutely fantastic. So now we actually have some choices there. Now, the fear a lot of people have is these neurotoxins and dermal fillers are going to make you look different. They're going to make you look strange. You're going to look like one of the real housewives on every county in the country. That is not true. We have a saying here at AesthetiCare, the best injectable is the least detectable. We want you to look natural, look younger, more youthful, more vibrant, but still look like you. The nicest thing about the neurotoxins and the fillers these days is the safety behind them. So neurotoxins in aesthetics were started to use in 1986. So you've got a huge amount of time of a safety profile, and they're not very painful. Teeny tiny needle, you feel a little pinch, but the changes can be amazing, especially in your forehead and your crow's feet to really relax those dynamic wrinkles. Now, dermal fillers have had a wonderful journey. When we opened 23 years ago, we had to skin test you for a dermal filler because you could be allergic to it. It was bovine collagen. But now the dermal fillers, almost all of them, are made of hyaluronic acid, a total natural substance that literally is located in every cell of your body. And it does amazing things to restore volume and fullness to your face, to your cheeks, the nasolabial fold, the marionette lines, the lips, defining jawline. We can do dermal fillers in the backs of hands to bring that youthful appearance there, even in the décolleté. And our providers are the highest trained injectors in the country. You will be amazed at how well prepared they will be to give you a youthful and wonderful appearance. So come in and find out all about injectables here at AesthetiCare. We look forward to seeing you very soon, and we're going to take amazing care of you.
These are my all-time favorite treatments to talk about, and we're talking about the topic of skin rejuvenation. So, we are all built different. Our skin responds to the sun differently. We age differently. So I would say the first thing that you should do is come into AesthetiCare Medspa. Give us the opportunity to do a complimentary consultation with you using a photography system that not only educates us, but you about your skin. So we'll look at the reds in your skin, the unwanted browns in the skin, the fine lines and wrinkles, the texture, scarring, pores, any of those topics that you're interested in talking about, we would love to cover. The next step is putting together a comprehensive plan. And this is where it gets really fun because we're going to incorporate things like hydrofacial, chemical peels, microneedling, RF. We can put together packages of laser with my all-time favorite laser treatment, BBL, Forever Young BBL, which is a light-based device that targets unwanted reds and browns in the skin to really give a balanced and even skin tone and texture, and also increases the health of the skin. We combine that treatment with things like Moxie and Halo for skin rejuvenation to peel the surface, help to soften and smooth those fine lines and wrinkles, including things also like injectables, as well as one of the most important things, at-home skincare and sunscreen. So there's a lot to choose from, you guys. Please come in, work with one of our experts. They've worked really hard to learn about all of the latest and greatest technologies to offer the safest yet most effective program for you. So look forward to seeing you and taking great care of you here at AesthetiCare Medspa.
When people think of aesthetic treatments, often they're mainly focused on the face. But I'm here to talk about the amazing things we can do for the body. So as far as fat goes, the way a lot of people think about fat is liposuction, okay? But there are non-invasive treatments for fat and to contour your body that are truly effective, safe, and the results can be wonderful. Cool sculpting is the leading treatment for the permanent elimination of unwanted fat. There have been over 12 million cool sculpting procedures worldwide. It has been proven safe and effective, and best of all, it is permanent. And then what can we do about muscle and tightening and toning the body? The M-Sculpt and the M-Sculpt Neo uses electromagnetic energy, literally in 30 minutes, to cause the equivalent of 20,000 sit-ups, or on the glutes, the equivalent of 20,000 lunges, to tighten and tone the body in those areas, and it's a truly scientifically advanced device. On top of that, what we can do for tissue tightening is absolutely wonderful. Treatments like SoftWave and microneedling RF and Indiva can tighten skin and lift skin. We're talking the neck, the jawline, the face, the brow, abdomen, for women postpartum after childbirth and they have the crepiness in the belly, to tighten that up, tighten loose skin on the thighs and the glutes. It can really transform the body and bring back that youthful appearance that you had in your 20s and 30s. So when you think of a med spa, don't just think of the face. We can treat head to toe with the most advanced technology and give you results that you're going to be so happy with. We look forward to seeing you soon and taking amazing care of you here at AesthetiCare.
Are you feeling tired, irritable? Your skin's looking drier, it's looking crepey, your digestion's off, you might be experiencing headaches. I was going through all of this and telling myself that I could just push through. Guess what? You don't have to push through. We have an amazing program with an anti-aging specialist through bioidentical hormones. Come in, have a consultation, have your hormones checked, work through an expert to help you get to a point where you feel better. This is just one piece of our wellness program here at AesthetiCare Medspa and Wellness. We want to help you not only look great, but feel great. So it's a combination of hormone balancing along with a new program that we've launched in weight loss. So as an Arizona Cardinal cheerleader, I've really worked through a number of different weight loss programs in my life, really focusing on fitness, working out, eating right, drinking water, taking supplements, all of those things. And after having a baby at 40, a lot of those things just felt like they weren't working. This is by far the best treatment we've ever seen for weight loss. It's safe, it's effective, it can help so many people in different ways. So if you have any questions about how you're feeling, you just want to feel better, do better than what you're doing now, come in, have a consultation. Let us help you here at AesthetiCare Medspa and Wellness. We look forward to taking great care of you.
We all want to have healthy, younger looking skin. And really there are two ways to achieve this. One are treatments you do in a med spa like here at AesthetiCare that are very effective. But another one, and just as important, is how you care for your skin at home. And if you're like me, you're absolutely amazed at the number of skincare products that are available on the market today. When you go into these mass retailers, whether it's a Walgreens or a CVS or a Target or Walmart, there are aisles and aisles of skincare products. And there's specialty skincare stores like Ulta and things like this that sell nothing but skincare products. It can be quite overwhelming. So what is the difference between a skincare product that is sold just over the counter at any retail store and products that are only sold through a physician facility, physician grade products? The main differences are, one, physician grade products are based on true clinical research, when over-the-counter products can pretty much say whatever they want and are based on marketing. Another very important factor is the level of active ingredients in these products. Physician-grade products have a much higher level of things such as antioxidants and peptides and growth factors than products that are simply sold over the counter. And another huge difference is the overall efficacy and the ability to truly change the skin through proper delivery vehicles as well as the proper nutrients in these products. We talk about, as an analogy, fertilizer. Why do we fertilize a plant? We fertilize a plant so it grows healthier, stronger, thicker, the whole 9 yards. We need to do the same for our skin because as we age, our skin loses the nutrients, the things that it needs to be healthy, things to encourage exfoliation and expose the younger, newer skin cells underneath the skin. The analogy that I like to use when comparing these two is anybody can walk into a drugstore, a Walgreens or CVS, and buy aspirin, okay? You don't need a script, nothing, anybody can do it. But you cannot walk in and say, hey, I'd like to buy some painkillers like Percocet or hydrocodone. To do that, you need a prescription from a doctor because they're way more powerful. And that is really the difference between over-the-counter skincare and physician-grade products. The over-the-counter skincare is the aspirin of our industry. Physician-grade products are the prescription strengths of our industry. And I tell you, once you try a good physician-grade product protocol at home, you will never go back to over-the-counter. So come into AesthetiCare, have a thorough skin analysis, and our experts in skincare will put together a program at home that we're going to give you the best results that you have ever seen. We look forward to seeing you soon here at AesthetiCare, and we promise we're going to take amazing care of you.
Hi, you guys.
Hey there. We're live here at the Ward Parkway location of AesthetiCare. This is the day of our big event. And if you're on this call now, and if you can make it out here from 3 to 7, we got a huge tent out there. We got a Nashville recording artist, Drew Six. We got great food, drinks, vendors, all kinds of games. We got a massive, what do they call it?
Beer pong.
Beer pong game. I mean, it's massive. These are full-size trash cans
Maybe
and
too much
stuff.
beer
So
pong
there
in
you
college,
go.
yeah.
But if you can come by 9225 Ward Parkway. But now we want to answer the questions, and we've got a bunch of them. Somebody did say they visited our Liberty location and put money on their account. Are they entered to win the $1,000? Yes, you are. And we have multiple $1,000 prizes. So you are entered if you put money at any of our locations or online.
Yep. So actually, if you attended this and you put money on your account online, you'll be entered twice.
There you go.
And if you come join us at the Ward Parkway location for the event, that's
Third time.
third
Yes.
entry. So come
Yep.
on over, then you'll be entered 3 times. So, all right. So next question, will lasers remove brown spots, or what other options are there? So we have so many pieces of technology, great technology. One of my all-time favorites, which is what I mentioned in the video, is called Broadband Light, or Forever Young BBL. It's an amazing treatment for pigmented lesions or brown spots. There are some spots that can look like a pigmented lesion, but actually might be something else. And in that case, we might need to do an additional treatment on it, like Moxie. So I think the best thing you can do is just come in for a consultation. We're not going to try to push you into something. We just really want to put together the right package of treatments based on your skin type and the expectations you have for results.
Yeah, I mean, that's one of the things we see the most is sun damage. So, and we've got great treatments. Now, I'm going to take this next question because I think it's more towards me.
Okay.
It says, my question is, can you make me look more like Kathy, please? Sure we can. Piece of cake. Come on in, man. We'll make you look
so sweet.
And I am so fortunate
Seriously.
to be married to this lovely woman.
Very sweet.
So,
can I get prices for rejuvenation? So rejuvenation, there's a number of topics that would be included there. So treatments like, let's skip that little thing. Things like Forever Young BBL, Moxie, Halo treatments, micro laser peel, Genius, all of those technologies would be considered rejuvenation. So pricings might range from $400 to $1,500 and everything in between based on the treatment that's right for you and your skin type and the results that you're looking to get. So I'm not trying to hide the prices from you. We'd love to give you those. It just depends really on the treatment that you're looking for.
And I think one thing that we have, we don't charge for this, is come in for a complimentary consultation. We have a skin analysis device that you put your face into. This capsule looks underneath your skin, has a 3-dimensional topography aspect, and it literally analyzes your skin in a way you could never do just by looking at it. We do not charge for this. So all you have to do is schedule a consultation. And then by the end of that consultation, you'll know exactly what treatments are going to give you the results that you're really looking for. The next question is, how do you test for hormones, blood work or a Dutch test? Listen, one thing we try to be here is extraordinarily thorough. And when you're dealing with hormones, dealing with weight loss, these are still drugs and medications, right? So you want to make sure you're doing this with the proper people who are well-trained. And our Dr. Amy Carter and her staff of well-trained nurse practitioners handle this. They do thorough blood work. They might look at saliva. And then they look at all the different, not just your hormones, but your vitamin levels. Like when it was me, I was low in vitamin D, low in vitamin B. My testosterone level was near the very bottom of the safe range, which does not make you feel good. And now I'm closer to the top and I feel amazing. So when you come here for hormones, they'll walk through in a consultation exactly the tests that they think are going to be best for you, and make sure that they're extremely thorough, and then following up with, and seeing how you're reacting to it so they can make sure you're on the right levels.
I have to say, I know I mentioned a little bit in the video, but I was in complete denial of being in perimenopause. And honestly, growing up, I really thought menopause was like maybe 6 months or a year long. Turns out perimenopause is a 10-year process that starts most of the time in our early 40s. So, why not come in, get your levels tested to know if you're 30, just to know where you are at 30, a healthy 30. And then at 40, you'll have so much more information to draw from. If you're 40, come in and get tested. And if you're over the age of 40, again, you can choose not to do anything right now, but at least you have the information and resources to make decisions based on where you are and what you want and how you want to feel. So yep. I am the biggest, we got to help all the women out there feel better.
She used to be really cranky, and now look at her. She's great. So.
Well, so many women are being diagnosed with depression and ADHD, and it's just hormone imbalance. So we can help you.
Yep.
All right. So what's the next one?
The next one, very great question too. Does the money placed on the account for this big event, saving your 20%, have to be used by a certain time period? And no, it never expires. It's all our products. In the vast majority of our treatments, there's a few treatments that are excluded, but almost all the treatments are 20% off. You put that on your account, never expires.
Okay, love it. So what was the treatment for crepey skin on the stomach? Not talking about bioidentical hormone replacement. So crepey skin on the stomach can be treated in a number of different ways. My favorite combination treatment for that is a combination of a treatment that's called Soft Wave with a treatment called Genius.
And that is the picture that I think they're referencing on here that they saw.
You're so smart.
Yeah.
All right. So good thing we agree on that. All right. So Soft Wave is a treatment that you come in, we apply a topical numbing cream that stays on for about an hour. It's removed, and then the device is an ultrasound technology that really creates this deep wound, kind of tricks the skin, the body into thinking there's an injury that's happened. And so they wake up the fibroblast cells to produce collagen elastin. So that treatment is a no downtime treatment. You'd leave here looking a little pink. But other than that, no one would know you had anything done. The second part of that treatment is called Genius. It's a microneedling RF, which stands for radio frequency treatment. And that uses two different types of technologies and the same delivery mechanism to create a wound to do a very similar thing in terms of building collagen elastin. So the microneedling is just what it sounds like. It's a grid of needles, generally a 7x7 grid of 49 needles that delivers heat deep in the dermis. And we get to choose the depth that those needles are delivered. So areas of the body that might have thinner skin, we treat more superficially. Areas of the body like the stomach, we're going to go deeper. So again, that treatment, we apply a topical numbing cream. It stays on for an hour. It's removed. The treatment takes about 30 minutes. And then you see little red dots for about 3 to 5 days. There's no specific, sloughing or real products that you have to use, very basic products like CeraVe cream. So overall, the results that we get, especially when we combine a treatment series of Soft Wave with Genius, it's kind of like working out and eating right. You get a much better result when you do them together. And that's what we found to be the best. And that's a treatment that can be done not only on the stomach, but the neck, the face, the arms,
thighs, the glutes,
yes,
anywhere where you need tissue tightening. And really, we've been in this industry. I've been doing it for almost 30 years now. And Soft Wave, I think, is the best tissue tightening device I've ever seen.
And it's amazing because the one that it's replaced hurt more. So
that's right.
This one, we've taken care of most of that.
Yeah.
So.
We got another question here. What do you recommend for wrinkles in the neck that have started appearing at age 65? Well, I'm close to that age, and I know what you feel. I know how you feel about wrinkles in the neck. And we all get them. There's a variety of treatments there. We just talked about Soft Wave for tissue tightening combined with microneedling RF. Halo, which is a fractional laser, which can cause a very nice contraction of skin. Combined with, there's some specific neck products. In fact, Revision has a product called Nectifirm that is really good, specifically targeted for tightening the neck. And like Kathy said, combining these treatments together. But again, what I would tell you is come in for that consultation. Let's do photo imaging on it. And then we can determine the amount of laxity you have. And with your age, that will help us determine which treatments are going to be best. But, obviously, if you have a lot of wrinkles down there, there is a surgical procedure called a neck lift. And we work with some world-class plastic surgeons. And we always want to be very honest with people that, hey, depending on the result that we're able to give, that way you can make a good decision. But that's why we always want to work with really good derms, really good plastics, and so that we're always offering you the absolute best option to meet your goals.
Absolutely. All right. So what do you suggest to treat melasma?
This is a specialty of hers.
I love this treatment. So, melasma, for those of you that don't know, it basically looks like brown patchy areas. And typically, a sign that you have melasma would be you have them. If you have the patch here, you have the patch here. If you have it here, you have it here. If you have it here, you have it here. And, it's more commonly called the mask of pregnancy.
Because of hormones, hormonal-induced type of pigmentation.
And it really used to be mainly just women through pregnancy that got melasma, but now we see it a lot with women that are just on hormones for many, many years and birth control pills. So how do we treat melasma? We have two amazing ways to approach melasma. The first is a laser called Moxie. And Moxie uses the energy gets absorbed by water and tissue, creates these micro channels of injury. And then all of the debris, the brown little dots come up to the surface. And over the course of about 7 days, they flake off. And it's like your braces have been removed and your teeth is so smooth, like all those little dots come off and it lifts the brown with it. And the skin looks a lot better. The melasma is much improved with that treatment. Typically, it's a series of visits between 1 to 2 of those treatments, or we also have an amazing mask that's called the AMP peel, the AesthetiCare Melasma peel. And so more typically, we'll combine a treatment of Moxie and about 30 to 60 days later, a treatment with the AMP peel. So it's really looking at your lifestyle and what triggers your melasma. If you go out in the sun and your hands are in the sun, the melasma can get worse on your face. So really looking at, this is not going to cure melasma, it manages it. And so we would sit down and talk about, when do you go on vacations? When are you out in the sun? What type of exercise do you do? Really discuss how melasma might be flaring for you, and then put together a series of visits to not only treat your melasma today, but keep your skin looking great all year long.
The next way, it's a great question. What happens to the fat cells when you use cool sculpting? Because as we said, cool sculpting permanently destroys cells. And what the clinical studies show is that when you treat an area with cool sculpting, in that area, 20 to 25% of those cells will die and they're going to be gone forever. And your body, in almost all instances, will never create a new fat cell, right? So what happens to those? Well, your body is amazing at cleaning out things that are dead. So one of the analogies I like to use, if you've ever had, some people have had like a deep splinter that never came out, and eventually your body breaks it down, goes away. When we treat leg veins with endovenous laser ablation, a fiber goes into that leg vein, destroys it from the inside, it collapses, but the vein is still there. 6 months later, they'll do an ultrasound and it's gone, because your body attacks those things. And what happens is your body will attack those dead fat cells over time, and it slowly will break them down, and you will eliminate them, to be honest, through your feces, through your urine, and even sweat. And people say, well, is that safe? Yes. In fact, they've done so much clinical research on it that there is it happens at such a slow pace that there is absolutely no danger, but they are gone forever. It is a permanent reduction of those fat cells.
So you brought up spider veins. So I'm going to jump to this one and then you can answer this one.
Sure.
So spider veins, what's the best way to get rid of spider veins on the legs? So Matt mentioned endovascular laser ablation, which is not something that we offer at AesthetiCare. But
that's for varicose veins.
Yes, that's for varicose veins. So for spider veins, there are a couple of different approaches. The all-time best is to see Ardith and to have sclerotherapy done.
Yeah, or Megan.
Yes,
that's
right.
And in
multiple locations. And so didn't mean to just shout out Ardith.
Okay.
Multiple team members, but they're amazing at using a needle and injecting into the vein, delivering a solution that dissolves the vein. So you'll actually see the result of the treatment on that day. It's not the long-term result, but you'll see the veins that she's actually treating. It's really amazing to watch. And they are so talented, and they put in so much time and effort into training and really making sure that they are the best at this procedure, because there's a lot that goes into it. And so I'm really, it's really fun to get to
one of our
talk about
nurses worked at a vascular surgeon for 7 years, and she taught this. It's called sclerotherapy, and it is the gold standard. So another good question, we've been talking about soft wave. Somebody asked, what's the difference between Ulthera and soft wave? I would tell you soft wave is simply a better mousetrap, right? Ulthera has been out a long time. We have it. And the results could be very good, but it was extremely expensive, and the pain was pretty significant, and it was a very tedious procedure. So soft wave came out, like many things do, and just improved. It's much faster. It's less painful. It's less tedious to perform. And also, it's not as expensive as Ulthera was. So it still uses highly focused ultrasound. It just does it in a better way, and we're seeing even better results. So again, it's just the new improved. I always tell people, you probably don't have the same cell phone you had 6 years ago, because things get better. This got better.
Absolutely. Okay, so what treatments are most common for women in their 30s? And this is, there's a lot of treatments that we do for women in their 30s now. I would say 10 to 15 years ago, we were treating more women in their late 30s, early 40s, but now we have women coming in their late 20s and 30s for treatments like hydrofacial. Definitely neurotoxin become very, very popular with our 30-somethings because it's preventative. It's going to prevent those wrinkles from forming. So neurotoxin is really popular, something like Botox or Dysport. Moxie, again, is another great treatment just because it has a very minimal downtime in terms of, like, you look red for a few days, there's a little bit of flaking for a couple days, and then the skin just looks so smooth. It really helps to shrink the pores. So when I think about a 30-something, typically it's going to be about keeping their skin looking healthy. Sometimes we have a 30-year-old that comes in and there's just been so much sun exposure over the years that maybe their skin age is closer to 40. And so we might do something more for that particular person. But overall, it's about hydrofacial, consistent exfoliation and hydration of the skin, sunscreen, of course, to protect the skin, and then looking at a treatment that might also keep that skin acting healthy and keep those fibroblast cells producing collagen instead of letting them go dormant or into retirement in our 30s.
Yeah, and we talk about there's two ways we look at skin, and one is the corrective stage, is getting skin to look beautiful, and then how do you maintain that? And so even the 30s, BBL is one, for example, is such a good and Moxie as keeping that skin looking good for a long time.
Well, we actually just got one of the questions is Forever Young BBL is miraculous.
And it is true.
So
true.
That is one treatment too that you could start a little
So I love
earlier.
this question. What do you recommend as a quarterly laser routine? I get Moxie BBL in the winter, but what about the rest of the year? Well, you know what's so cool? One of our favorite pictures is a woman. She's 38 years old and she had a lot of sun damage. She had 3 Forever Young BBLs per year for 11 years. And then there's a picture at 49. Her skin looks much better at 49 than she did at 38. So depending on, obviously financially what you can afford, I will tell you doing, especially when you get into the 30s and 40s and 50s, if you could do that 3 to 4 Forever Young BBLs per year, maybe once a quarter, it's amazing the anti-aging aspect. And it's based on a study done at Stanford University, which showed that regular Forever Young BBLs will cause the genetic expression of the cells of your skin to reverse themselves. So we're talking about true cell appearance reversal. So BBL and the fact that you're doing a BBL Moxie every year is fantastic, but that and then good skincare at home. And like you talked about, maybe an occasional exfoliating, hydrating treatment like a transformation medical facial, which we have here, or an anti-aging hydrofacial would be wonderful for that.
I mean, just a little, another BBL moment is that, so I have rosacea, which is just flushing and blushing. I'm constantly red until I have my Forever Young BBL. So the common question I get is, can you have too many? And I will say I have about 6 to 9 per year based on what's happening in the environment. So if I go to a really cold Chiefs game and it's the first cold Chiefs game of the year, my rosacea flares. So I'm flushing and red. I come in, I have a Forever Young BBL treatment. It shuts that down and my skin looks great again. So it really is, again, we're so lucky we get to tailor all of these treatments specific to you and your skin and the results that you would like to see.
I think that would be a great one for you right there.
All right. Hi, thank you so much for offering this live. When I am unable to attend in person, you bet. So are you able to offer BBL spot treatments focused on spots, reds and browns that remain after a full BBL treatment? So yes, great question. So can we treat some of the spots that remain after a treatment? So some spots, aren't going to respond to BBL. And why is that? So when we look at BBL, broadband light, we use different filters in the handpiece that gets absorbed by different chromophores or targets in the skin. So one wavelength of light gets absorbed in melanin in a brown spot. Some wavelengths get absorbed in oxyhemoglobin, or what's causing the skin to look red. So there's a target, just like a sniper has a target, it's going after something specific in the skin. So if your spot is there and there is no melanin in it, so if it's a SK, a seborrheic keratosis, which is just, you can talk to your dermatologist and get those diagnosed, which is just basically a buildup of dead skin or protein in the skin. There is no melanin there for the light to get absorbed by. So if you walk outside in a hot summer day, that black shirt absorbs all that light, but your white shirt is going to be nice and cool. That's kind of an analogy that you can think about. So some of those spots don't have the target in order for the BBL to have an effect on those. So one, if you come in and it's truly a pigmented lesion, absolutely we can spot treat. I think in better case scenario, it's doing a combination of like a BBL with a Moxie, because in that situation we can target multiple types of spots.
Yeah, and sometimes we can use a single spot like erbium laser to ablate that off if it's a really stubborn one.
Right. Yeah,
Yep.
or the cryopen.
Yeah.
So we've got lots of ways.
stuff.
It's just really looking at what's causing that spot. And then when we know what's causing that spot, whether it's melanin or dead skin cells or redness, sometimes it's redness, then we can choose the right technology to do the spot treatment to get the result that you're looking for.
Now, this is a great question. Do you have any treatment or ideas for what to do for under eye circles? I look like a raccoon with swollen eyes. I will tell you, this is a great question because a lot of people deal, especially as we get older and they start looking tired, they get a little saggy under their discoloration. One thing I highly recommend you come in, the system I was talking about earlier that we analyze skin with, the Viscia, allows us to break out what is vascular and what is pigment. And what a lot of people don't realize is a lot of things under the eyes are vascular related, and some are pigment. But when you have this consultation, and again, there's no charge for it, and we use this device, we'll be able to really zero in on what is going on and then recommend, do we have to attack it more vascular with kind of a BBL or 1064 type laser? Is it more pigment, which may be a Moxie or things, or maybe it's a combination of the two? Combine that with some good under eye product. There's some phenomenal ones by Revision and by Skin Better and some of those companies that will really help over time. But again, that is going to be really well addressed in that consultation. Now, keep in mind, if you do put any money on your account this week, today, obviously, you're going to get a text message asking if you want to take advantage of this. You can put money down and then have the consultation and then determine, hey, what treatments do I want to use?
You bet. I'm going to go to this one.
Okay.
Oh, no, I'm going to go to this one. You can go do this one.
Okay.
Okay. So for lasers, are there any special considerations for ethnic skin? Absolutely, there are. And one of the things that happens in our industry when a company comes in to sell us a laser, oftentimes they will try to make it sound like it can fix everything. It can do everything because they want us to buy the laser. And guess what? That's not the case. One tool does not fix everything. One tool does not treat all skin types safely. And many clinics don't want to make the investment of $150,000, $200,000, $300,000 into multiple devices to be able to address all conditions with multiple skin types. But we are on the cutting edge of technology. We're on the cutting edge of education. We are a national training facility. And so we bring in treatments that are appropriate for all skin types. And as a client with melanin-rich skin, we're going to really talk about treatments that are specific for you, that are safe for you, because that's our number one concern, is safety. So yes, there are many special considerations for that. And we do have experts that can help you with that, as well as the technology to treat you safely.
Yep. This next one, and there is a lot of fear out there about doing injectables because, one, I don't want to look weird.
What's
I don't
the
want to.
question?
Yeah, it is. I'm going to tell you.
Okay.
Oh, wow.
Okay.
Impatient. It says, I'm interested in Botox in my forehead, but I'm scared. Eye droop is a real thing. How often does this happen in patients? It is a real thing. And when it happens, first of all, this is why I would obviously, we'd love to have all your business, right? That's what we do. But wherever you go, you got to do your research and find out how well trained the injector is. Because as a national training center, we've trained over 2,200 clinics, and almost all of them are undertrained. And so one thing that we decided when we were going to do this clinic is we are always going to have the best trained people. And that includes our RNs and nurse practitioners who inject. They've been thoroughly trained so they can understand the musculature of your forehead, the glabella area, where to properly put the Botox or the Dysport or the Daxxify. And when you come in the first time, we are always going to err on too little because we can always add more. Okay, but you can't take it out. All right. So we're going to start easy, and then we're going to have you come back in 2 weeks, and we're going to analyze the results because we can always add more. So the thing about ptosis and the drooping eyes called ptosis is usually the product was placed in an area where maybe it shouldn't have been placed, or too much was placed there. And listen, I'm not telling you at all that this never happens, because it does. It's pretty rare for us when it happens. In fact, it's very rare. But even the best injector is a human, and they can make a mistake. But what we're going to do is make sure that you are being seen by somebody who is absolutely thoroughly trained. We're going to do little before we do a lot, and we're going to monitor with photography your results. So again, come in for that consultation. We totally understand your fear. Again, we have a saying, the best injectable is the least detectable. We want you to look natural, more youthful, but still like you.
All right. What is the best facial treatment to help with large pores? So large pores can be a little tricky, and it's one of those things that we don't fix and then it never comes back. So I would say the best way to really treat large pores is to get on a regimen that you stick to every year. And it might be adjusted based on other things that you would like to see improved in your skin. So large pores, definitely a good at-home skincare regimen. And then in terms of technology, I have two favorites for large pores. One is Moxie, because again, it can be used on all skin types. And it's a treatment that is relatively fast. After the numbing cream is removed, the treatment itself takes about 7 to 10 minutes. So very easy for the client. And then those little channels are created. You have all these little spots that come up and then it sloughs off. And so instantly within one, you feel the texture change for the week, but within that week, the texture changes and you get to see that result very quickly. So I love Moxie because it gives us that instant gratification that, I don't know, I'm always looking for. And then two, it can help so many people. And then the other treatment would be microneedling RF, Genius, which can also be done year round. Even if you've been in the sun, you can have Genius. So again, it gives us a couple of different modalities to treat you, depending on what time of year it is, what type of skin, in terms of not only age, but ethnicity, so that we have tools to go to work and help you with your large pores.
The next, actually, two questions combined here. They're really asking about insurance covering hormone replacement therapy, I'm sure weight loss. And the answer is no. For us, we don't take any insurance. Everything is elective. There are issues with dramatic hormone imbalances where you would go to a physician, insurance would cover it. But the problem is hormones are judged on a range. So at my age, for a man, my testosterone level should be somewhere in the neighborhood of between 250 and 1200, this massive range. So if you went to your doctor and you got a blood test and my hormones were at 300, they'd say, well, no, you're in the safe range, so insurance is not going to cover that. But 300 is not a good number. It's just a safe number. But also 900 is a safe number. 1,000 is a safe number. So when you come in, and I do want to clear this up because I think maybe we've misspoken when we talk about free consultations. Any aesthetic consultation is complimentary. But a medical consultation with one of our doctors or nurse practitioners for hormone replacement therapy, there is a charge for that. And basically you come in twice because the first time you're going to meet, get a thorough health history, talk about what's going on. Then they're going to order the blood panel or any other tests they want to do. Obviously, those are covered. The tests are covered by your insurance. Then you're going to come back and then they're going to analyze the results and put together a plan for you. So there are charges for that consultation. There are no charges for aesthetic consultations.
Okay. All right. I'm 70 years old. My chest has had lots of sun damage. It is now very wrinkly. What do you suggest to make it look tighter and better? And so this would be done over a series of visits and a treatment done over a series of visits, a combination of Forever Young BBL to address the brown spots that have probably come up from those years of sun damage. And then we can do things like Sculptra, which is an injectable for the chest for those fine lines and wrinkles. And then we can also do some tissue tightening treatments like Soft Wave or Genius. So we would put together typically a package of something like that. So some broadband light with a no downtime tissue tightening treatment with some injectables. And that really can make a significant improvement. We're not going to get rid of them, but it definitely can make a significant improvement.
I love this because we've been asked, somebody goes, oh my gosh, depression, ADD, hormones, being grumpy. I feel seen. You guys are great. I will tell you, one of the coolest things is when people, and we have so many of our staff here, Kathy and I are testaments to hormone balancing and how much better that makes us feel. Kathy is really in tune with the perimenopause issue and what it's done for her. But it's so much fun. No, I mean, just how it's changed.
Yeah.
And, but this person who wrote that, I mean, do check this out because I will tell you, even our daughter, who's only 22 years old, we had checked and they found out she had some vitamin deficiencies and a hormone imbalance at that age, which can really change mood. So it's so good for your health. It's just so good.
It's just, there are options and they're just not talked about often enough. So there is an event in Kansas City on November 3rd. Dr. Marie Claire Haver, check her out on Instagram. Between her socials, she has about 3 million followers. She just came out with a new book, The New Menopause, which is a New York Times bestseller. Follow her, read the book, download it. It will change your life. And then there's an event. She's actually coming to Kansas City because her husband loves the Kansas City Chiefs.
Who doesn't? Yes.
So there's an event on the Plaza November 3rd. Follow us at AesthetiCare KC on Instagram to get all of the information on that. And you can click and get tickets to that event through us. So we'll help you with that. We'd love to help you with that.
AesthetiCare is sponsoring this event. So I'm hoping to become pregnant in the next year. Should I hold off on treatments while trying to get pregnant or while pregnant? Well, as far as aesthetic treatments, no, you could do anything you want.
But
even though
when in
you're trying to
doubt,
get pregnant.
don't do treatments. When in doubt, you stick. I don't know. I'm the thing
No,
with
no,
pregnancy.
she's not pregnant now.
I
But the
know.
best thing to also talk to your OBGYN.
Mhm.
But there's nothing, most of the things we do, nothing goes in the bloodstream, it's things like that. So now as far as the hormone stuff, when you come here, our medical director for the medical weight loss is an anti-aging wellness doctor and OBGYN. So she'd be a
Over 25 years.
she'd be a wonderful person. But yeah, it's always better to be safe than sorry. But aesthetic treatments, really, I've never heard of any contraindication of somebody who's just trying to get pregnant.
Right. Okay, so I have droopy skin under my chin and wrinkles on my neck and had soft wave but wasn't totally effective. It did help some. What would be the next procedure? So I almost said your name, so sorry. So that happens. Soft wave is not a surgical procedure. So I always tell my clients, if the expectation is something like this, like a facelift, we really just aren't able to get that type of results with non-surgical treatments. But I love that you did get some effectiveness from that treatment. That treatment is not a one or done. So if we got some results with that, it would be great to do it again and to add that treatment of Genius with it to give it that next level result. So I think it's going to be just continual visits and continual treatments to continue the results that you're getting from that soft wave treatment. And remember, the result that we get or the treatment that we do today, the end result from soft wave is still 3 months out. So depending on when you had that treatment, you may still see some benefits from that treatment that you haven't yet seen.
Yeah, and a lot of the physicians we work with say, like with soft wave and Ulthera, the best results actually would be 6 to 9 months out, because what it's doing is it's stimulating the cells to produce more collagen, but that's not a light switch, so it takes time. So yeah. Can you talk about the micro laser peel? It's a great question, because micro laser peel for years has been one of our favorite. In fact, before Halo and Moxie came out, it was one of the most popular treatments here at AesthetiCare. So micro laser peel, unlike a fractional laser puts microscopic channels into the skin, where the micro laser peel removes 100% of the skin, but to the depth of our choosing. Micro laser peels are not very deep. They're not very
I
aggressive.
was going to say that kind of sounds scary. Removes 100% of the
No,
skin.
well, I mean, it could be just the tiniest outer layer. I mean, we choose the depth, and that's measured in microns,
Like the
right?
dead skin cell layer.
Microns, yeah, microns are 1/1000th of a millimeter, so they're very, very small. But the micro laser peel, we can use some topical numbing. It's not a very painful procedure at all, but it can be a fantastic result, especially for superficial issues. Even combining that with a fractional laser can be wonderful. So again, this is where a consultation would come in so handy to really look at your skin and analyze which of those treatments is going to give you the best result.
All right, awesome. So do you have to continue to put an amount of money on your account every month? And is there a minimum amount that has to be placed? So this is a once a year program where we offer 20% off, where money can go on your account. So in the future, you use that money, which gives you 20% off of the treatments, most of the treatments that you book throughout the year. So we only offer this program once a year. We do have a new membership though. So you can join our membership at AesthetiCare, which is $199 a month, and 100% of that money goes to your account. And then you get 10% off of all treatments all year long. So if you're looking for a way to kind of do more of like a layaway program, which I always loved when those were available, then you can put $199 on your account on a monthly basis and save that up for maybe that one big injectable visit or that one big laser treatment, and then it gives you 10% off of that treatment as well.
Yeah, it's called our GlowFundMe package. And so now, as far as, is there a minimum amount that has to be placed? No, you could put $20 down. You can put whatever you want, and it never expires.
And the way to do that, because I think I saw a question earlier, is you can just do it on our website. So greatskinkc.com. You can call us, and we definitely have a team who is here ready to answer the phone call as well. But if you're savvy with a website, it's really easy just to go to greatskinkc.com and put money down there.
Is microneedling great for exfoliation on the face? There are better treatments for exfoliation. Microneedling puts little channels into the skin, which causes an injury to create long-term collagen production, which is fantastic. It's a really good treatment. And then when you add radio frequency to that, it's even better because it creates more of a thermal injury. But as far as just exfoliation, things like a hydrofacial combined with dermaplaning, or a transformation medical facial, which has dermaplaning and microdermabrasion. It really does a great job of dramatically reducing the dead skin layer and creating that nice glow. Moxie causes a great exfoliation of the skin. So does Halo. But microneedling, if you're just looking for exfoliation, I think there's some better treatments, but combining those therapies together is always the best. You always get the best results.
Absolutely. Okay, so I think I jumped ahead. How do we get the 20% off if we can't come to the party in person? So that's where you can go to the website. You can call us. Either of those things will work. So you don't have to come in person, although we would love to see you as well.
Yeah, I mean, call any of the 3 locations. Like I said, go to the website and it's right there for you. Okay, how do you enter win the prizes? Well, if you stay to the end of this, you are going to be entered to win a $1,000 gift card. If you go to the website and put money down, you're going to be entered to win. If you come to the event this evening from 3 to 7 and register there, you're going to be entered to win. We have multiple $1,000 gift cards, not just one, that we're giving out. So lots of ways to enter to win.
Okay. So I've heard of the vampire facial. What is this and how does it work? So the vampire facial is a combination of 2 modalities. One is microneedling. That's what Matt was just talking about, where we use a device that creates these micro channels in the skin mechanically with a needle. And so there is, when the client was asking, or the participant was asking, does microneedling exfoliate, and he gave a different answer. Microneedling is step 1 to the vampire facial. Step 2 is a nurse or healthcare professional will draw your blood and put it into a device that spins it and pulls out the PRP, or platelet-rich plasma. So uses your own your own blood to treat the skin. So it gives it, just really great healing properties, anti-inflammatory properties. And the reason why it's called the vampire facial is because we're drawing blood and then applying that to the face. But there's so many great ways to use PRP that really help the skin to heal. So again, promote healing, promote those fibroblasts to produce collagen elastin. And so that's actually something that we can do after treatments like Halo, microneedling RF, microneedling. It can be used in a lot of different ways. There was just one physician that had trademarked it, coined the phrase vampire facial.
And we have topical exosomes now, which we believe are more potent than the platelet-rich plasma, and we don't have to draw the blood.
Right. So
get
we have
a better
much,
result.
Much easier way to do it, which is even more effective. And so that's something.
So this is a good question. Is there anything you can do for lip softness besides a full $600 syringe of filler? And it's true, so filler is expensive, but today a $600 syringe of filler would actually cost you $480 because 20% off. But there's half syringes. In fact, a lot of people who do lips only purchase the half syringe, and it's much cheaper, obviously. Now, if you don't want filler at all, and that's, some people are worried, but keep in mind, you can do just a teeny bit. You don't have to do a lot of filler. You can just even accentuate the Cupid's bow there. I mean, there's a lot of ways that our great injectors can do this. But there's also a product by Revision that I'm telling you, I think every member of our 65-person female staff uses, that really softens the lip and also gives a little plumping as well. And that's just a topical product. So that might be something to be fun to try. In fact, somebody right here just pulled it out. I'll show it to you. It's the youthful lip replenisher. And it's by Revision. And it is, I mean, people just get addicted to this stuff. So there you go.
Okay, so how often should you do face filler? So that is a question that's really going to vary based on your age and then how much volume you've lost. So if you come in as a 30-something, we may do a little bit in the lips, meaning a half syringe possibly, and then a little bit maybe in the cheeks to give the cheeks some volume. Because when we're younger, our face is an upside down triangle. And as we age, it flip-flops and everything falls in this direction. So as a 40-something, we're going to do more for cheek volume. Maybe if you've, I started to look kind of like a peanut shape. And so some volume in my temples. I've had volume added to my jawline and my chin. So, as we have come in as a 50-year-old and 60-year-old, again, it's all going to be about your facial structure and then the volume that you've lost based on what you looked like as a 20-something, because we don't want to change your face. We just want to make you feel your natural youngest self. And so, it may be most filler lasts about a year. Some is FDA approved for 18 to 24 months. But I would say typically if you come in for that full correction phase, you'll be back within about 18 months to touch up. You're not going to probably need to do the whole thing again, but typically it's a little touch up. Maybe your lips have gotten a little, look a little drier, or they've started to move in. Kind of I always say, like, you feel like you're starting to eat your lips. And so we want to pull those out a bit. But I would say about every 12 to 18 months, depending on your age and your volume loss.
Mm-hmm. Question, do you have a local plastic surgeon you can recommend? And it says, P.S., you do a great job, thanks. Listen, I'm going to, the person who wrote this, if you're on, please send an email to info@greatskinkc.com. Again, info@greatskinkc.com, and say, please give this to Matt, and I will reach out to you, because we work with a variety, and depending on if you're looking for face or body work, depending on what you want, certain plastic surgeons specialize in certain things, and we can help direct you into somebody who's really good that you'll trust.
All right. So when is the promotion finishing up? Saturday.
Yes. So if you can't come today, you can go online through Saturday, or you can come see us physically. And we're open all day today, Saturday? And we're open on Friday. And then which clinic is open? 9 to 3, and then 9 to 3 on Saturday at Ward Park, where you can come in. But you can go online, or you can just call any of the locations, give us your credit card number, we'll take care of you.
Okay, so are there any treatments to help hooded eyes? This is a tricky one, you guys, because to go over the eyes with lasers, many of them require interocular shields, which basically look like a metal contact, which we don't offer here. So typically what we do is we treat what we can pull up to the bone. So we can treat the skin right here, and then we'll treat the skin all above it so that it does help with a little lift. I had a blepharoplasty about, I don't know, 6 or 7 years ago with a plastic surgeon, where they go in and they just cut a little skin and then sew it back together. And I think, like, if you're really considering, you really have some hooding going on, that's going to be the best approach to that. And that's not something that we offer here. If you're looking for a non-surgical approach, something like SoftWave and Genius, that microneedling RF device.
And AgeJet, we can actually do right on the lids too.
That's true. We can.
Yep.
So there's a combination, but whenever I hear hooded eyes, I typically go to, you probably need a surgical procedure for the result that you're looking for. But come in, we'll do the consultation. We're going to be very honest and not push you to do anything that's not going to get you to those results that you're looking for.
Should I be wearing sunscreen every day on my hands too? Great questions. Think about when you drive. Where are your hands? There should be 10 o'clock, 2 o'clock. At least one of them's on there. The windows in your car do not block out the damaging rays of the sun. And so if you look at sun damage, the biggest sun damage is face, neck, for women, décolleté, and hands. And as women get older, men get older, you get the brown spots and stuff. That can be avoided. Sunblock is the key.
Well, especially because, well, melanoma.
Yeah.
We want to avoid skin cancer.
Yeah.
So even it has nothing to do with looking young or having young skin, just overall skin and body health. Sunscreen is so important. So yes, always from head to toe. Which one are you going to?
I am going to talk about what is the difference between BBL and Forever Young BBL. It's a great question. So BBL stands for broadband light, and the system is called a BBL system. Forever Young BBL is just a protocol utilizing BBL. It's a more advanced protocol. So for years, when the first IPL device came out, and this is back when I sold equipment back in the late 90s, we thought we just had the godsend for reds and browns. We thought this is a treatment just for reds and browns. And it was called photorejuvenation, photofacial. And then BBL came out about 2006, I believe. And it was just, again, a better mousetrap, a better device. And it's called BBL instead of IPL. But what was realized during that Stanford study was, if you dumped more and more light into the tissue, you got bigger and bigger changes, not just in colors, but overall quality of the skin and the anti-aging aspect. And what I tell people is, why does a plant look so different in January than it does in June? It's because of light. The longer the days of sunlight, the stronger the light. Something happens to a plant, says, oh my God, something's going on. I'm going to turn green and grow. Well, the more light we dump into your tissue, the bigger cellular change we get. So Forever Young BBL is just a much more elaborate protocol, and it's going to give you a better result than traditional IPL or BBL, which was really just targeting colors.
And it's just one of those treatments, again, that we get to create a protocol specific for you and your skin needs. And so, we can treat reds and browns at the same time as dumping in all this light for long-term health benefits.
Correct.
Okay, so sclerotherapy, is it covered through insurance? So no, none of the treatments that we're talking about in terms of cosmetic treatments are covered we don't take insurance at AesthetiCare.
Okay, so what laser treatment would you recommend to reduce the size of pores on your face? I think we addressed this, right? And we did just a little bit earlier. Here we go. Somebody just thanking us for the time. Now, somebody said they had to log off, and if that's true, remember, you can still get registered to win on our website or for you coming in person.
Okay, what do you want to do here?
Well, why don't you take, can you do anything for AKs?
So
Actinic keratosis. Yes, we can.
We can. So for AKs, there's a number of different types of treatments. I will say that if you go to a dermatologist, you can get that covered by insurance typically. So I want to put that out there. We've been asked about insurance quite a bit. And there's a treatment that's PDT or photodynamic therapy where they apply a product called Levulan and then activate it with a light. So that is a way to treat your AKs. If you have a dermatologist that you're currently seeing, you can definitely start there. But AKs can also be treated with different types of lasers, a single spot laser that would treat the specific spot, or cryotherapy that can also treat that specific spot.
Okay, somebody asked, can you do BBL on the chest and arms? We can do BBL from the top of your head to the toes. So literally anywhere where you have sun damage, anywhere where you have aging skin, BBL, and that's one of the beauties of BBL, Moxie, and Halo is, yes, we can do it absolutely anywhere.
Okay, you answered that one. What can I do for too many aging lines around the lips?
Oh, that's a question we get a lot.
Yes. So there's a combination therapy between lasers and injectables. And so the first step is to do a laser treatment that helps to soften the lines and wrinkles by ablating the tissue. The skin heals over and you have smoother tissue or smoother skin. And then step 2 would be to add a little bit of filler. If you do too much filler, it starts to pull the mouth forward and can look kind of weird. So that's what we like to address as much as we can with laser technology first, and then do kind of the fine tuning with injectables like filler.
And a lot of people think lip filler in the lips. So if you have vertical lines here, they can put just a tiny little bead of hyaluronic acid in there to really soften that. So how do you put money on your account? Like I said, go to the website, come in person, or call us. 3 different ways you can put money on your account.
Okay. Are all these treatments also available at your Liberty location? Most of the treatments that we've talked about today are also offered at Liberty and Lenexa. Some of the treatments are not. So definitely one of those things, if you have a very specific treatment that you're have questions about, make sure you ask on the phone when you give a call in to book that consultation, is this specific treatment offered here? And they'll be able to cover that question for you because, Ward Parkway, we have 20,000 square feet. In Liberty and Lenexa, we have about 3,000. So we don't have as many rooms to be able to offer as much. So if we don't offer it there, you can come on over to Ward Parkway.
Here's a great question. How do you determine which neurotoxin to use? Well, the animal out there, the name, the Kleenex is Botox. It's been out the longest. When we opened AesthetiCare in 2001, it was the only one out there. Now, luckily for consumers, there is competition, which helps. There's a lot of Xeomin and Jeuveau are 2 out there. We've chosen not to carry them. We tried them extensively. We just didn't feel like we got the same good results as we use Botox and Dysport. The most recent clinical study, it was called the DREAM study, shows that Dysport actually onsets a little quicker and lasts a little longer. And so they're both very good. When you come in, the injector will talk to you and recommend the one which specifically is best for you. Daxxify is a newer one that also I think is going to be very good. Some of the protocols in some of the areas were still being worked out, but in the glabella area, I mean, I had it done, I got almost 6 months out of it. So those are the 3 I'd really focus on. But again, let the experts, our injectors, really guide you on that journey.
Okay, I'm going to do this one.
Okay.
So what do you recommend to address acne scarring and then preventing future acne? So it looks like you're already on some medication. So I'll tackle the acne scarring, which there's so many great ways to tackle scarring. And we look at scarring like this. One, what color is the scar? So it could be acne scars, trauma scar, burn scar. Is there red in it? Then we use BBL to treat the redness. Is there brown in it? We use Moxie to treat the brown. And then we use treatments like Halo and Profractional and Genius to treat texture, whether it's hyper or hypotrophic. So we would put together a combination of those technologies based on how your acne scarring presents. And then it's really a journey. You're not going to come in for one treatment and solve the acne scarring problem. I really, really, really wish that were the case. Typically, we see you every 3 months for a treatment, and we address that treatment based on how the scar changes. So the redness might improve. We may not be doing BBL anymore. The brownness goes away. We wouldn't be doing Moxie anymore. The texture is nice and smooth. We would change out the treatment that we do. So we really want to customize that protocol for you based on how your scarring presents and how your skin responds to that series of treatments.
Do we prescribe medical grade retinol and tretinoin? Yes, our doctors and nurse practitioners can do that. Again, based on your skin condition, we also carry things here that can be very successful for that.
Okay. So I've had a complete hysterectomy and postmenopausal. Will hormone treatment work for me? I am not a hormone specialist. I definitely would want you to sit down with Dr. Amy Carter or one of our nurse practitioners that really specialize, look at your complete medical history. But if healthy and all things look great, you can do hormone therapy really at any age. So again, I don't want to answer all the details with that. I think the consultation is the best approach.
Here's a question. What is the risk of dermal filler traveling if you do it under the eye? And is there a safer alternative? Filler can migrate a little bit, won't migrate a lot, but again, it's going to a lot dependent on the skill of the injector. And that's why, if you come in and you meet with our injectors, I think they can put you to ease and show you a lot of good before and after pictures. As far as alternative, we have a plasma device called the Age Jet, which is wonderful for tightening underneath the eyes, as well as things like Moxie and Halo. We can get right up to the lash line in there. So there are alternatives to that. And again, and you've heard us say it 100 times, but man, come in for that consultation because everybody is different. And we want to put together a plan that's going to give you the best results.
All right. So another question about the enter to win. Again, if you put money on your account online, you're entered to win. If you stay to the end, you're entered to win. And if you come in, you're also to the clinic, you're also entered to win. Okay. So thank you for the shout out that we're doing an excellent job. We appreciate that. All right.
One question came up with filler. If you have a full syringe or a half syringe, do you have to use it at the same time? You do. It is OSHA will not allow us to store partially used dermal fillers. There's a safety contamination danger in there. Again, we want to be as safe as possible.
Definitely. So I'm starting to have sagging skin around the jawline and jowls. I've heard of Sculptra. Could you explain the benefits? So Sculptra is a biostimulator, which means that it's going to help build your own collagen. It's going to help build your own scaffolding. So I talked about the upside down triangle becomes a regular triangle. And so Sculptra is excellent for putting up the 4x4s to keep the house up. And so it's excellent for I've had it in my temples here along my jaw, even it can be added into neck and chest areas and different areas. There's even the Sculptra booty lift. And so with Sculptra, you get an immediate effect. It fills the area, but then that's just the saline that's the mechanism or the delivery action for the Sculptra. And then over the course of 3 to 6 months, that builds. So Sculptra is excellent to provide the foundation for the hyaluronic acid fillers that Matt talked about earlier.
Okay, so it's 1:06. There's still 76 questions, and I know a lot of you are waiting to the end to get entered. So we are going to wrap this up. But thank you for all the great questions. Hopefully we've answered a lot of them, and I think a lot of them are repeat. But we do want to remind you, if you can stop by 9225 Ward Parkway today, you wait till you see what we have out there. It's amazing. It's going to be like a concert. It's going to be so much fun. Or remember, go online, put money down, come in person, put money down, or just call us and put money down. But we would love to see you here. We look forward to, again, when you put that money down, it does not expire. You can put whatever amount you want. You're going to save 20%. And then you can come in for your consultation and figure out, hey, what treatments? We have over 65 different treatments, and we really want to make sure we get the treatments that are best for you. But we want to thank you so much for joining. Hopefully you learned some good things here, and we hope to see you super soon here. We really hope we see you today.
That's right. Thank you so much. We hope we get to see you this afternoon. Come by and say hi.
Here we go.